Here in East Kent Hospital NHS University Foundation Trust, we are very excited to support T-level students in the hope once they complete their studies, we can employ them to make excellent employees.
We have a programme that we've developed for the students to give them a complete overview on what we offer with the medical day unit. So each day when they come in, they're allocated to a different area. That could be shadowing a consultant in the clinics or one of the nurse specialists. We also offer them to observe the mixing of our medications and actually delivering those to the patients.
The initial pilot programme was a 2-day-a-week programme for 15 weeks. Now we have implemented a block placement, and we do 3 block placements from January to June for the students. We've worked closely with the areas that have opened up their doors to facilitate these placements in the hospitals that we are using.
So when I was at placement, I was doing taking patients' observations, calling them in from the waiting room and things, and I was watching it on ECGs.
I've learned multiple different things. I learned how they take clinical observations in the NHS compared to how other clinics take them. I learned how to work alongside a patient, not just work for them. I've learned how the NHS run things. I enjoyed taking part in handover and really experiencing the NHS as a whole.
So since moving on to the 2-week programme, we've actually noticed the development in the students from their first day to the last day. They're starting to develop, they're becoming more confident, they're having that continuity. They've been able to see from putting the theory into practice.
I think it's made me see what nurses do around wards, how doctors have all certain different jobs and how it kind of works around patients coming in and leaving and all the tests and stuff that have to be run. So I gain a bit of knowledge with what certain units do and how they can help people.
If when they see what we offer within our trust and the NHS, they decide they'd like to come into the programme, then myself and Jackie work very closely on our other programmes which can lead them in to working firstly as a healthcare support worker and then go on to the apprenticeship programmes and work with us as a member of our staff.
Well, hopefully when I finish my course I'm going to do a paramedic course to become a paramedic.
Georgie got on very well. We've seen her grow, develop from when she first came to us. She's learnt many skills. She's definitely got great potential for going forward. She came in as this sort of small bud, and yet when she actually left, she blossomed, into this beautiful flower who you could see really has got such potential, and hopefully she will make a fantastic nurse.
I loved working in the medical day unit. Everyone was really friendly. It was very team-like. There was no one left out. They made me feel comfortable and that trying new things is okay. They were really lovely, really welcoming, and made me realise that the NHS is where I want to be.